Good afternoon. My name is Stephen Carr, and welcome to the Salvation Army virtual town hall on homelessness and housing insecurity. Today, I am blessed to be with Andrea Chapman and Carol Randolph, who is here with part of our homeless and housing insecurity programs in the Metropolitan Division here at the Salvation Army. We have some exciting contents and some great questions for them today, and we are going to get right into it and jump right into the program and see what type of information they can share with our communities today. Andrea, or I'm sorry, Carol, I'm going to lead off with you. Thank you for being here today.
Thank you for having us.
What is homelessness and housing insecurity, and what leads to it?
Well, HUD defines homelessness as not having a regular, fixed, and consistent overnight resident for an individual or family to live. And because of that, if you are living with a relative and it's not a consistent living situation, or if you're living in your car, or if you're sleeping in the park, that is not a regular, fixed, and consistent resident to stay at overnight. So that is the definition as the federal government and HUD define it. In terms of housing insecurity, it's not having a place to call home. It's not having a place that you know on a daily basis that you'll be able to go to, lay your head down, and do the things that most of us do when we go home. Now, there are a number of factors that cause homelessness. One of the greatest factors is economic disparity among communities and individuals. Also, what leads to homelessness oftentimes is lacking the necessary supports in terms of family and friends. And what I have found, and I think it's very important, and often people don't understand, is that there are a lot of individuals, because of the way they were raised, aging out of the foster care system, not having a consistent family situation, don't have the necessary skills and tools to know how to set up a household, know how to pay bills, and just in general, not knowing how to have those daily skills that oftentimes we assume that people receive when they're growing up.
Thank you, Carol.
Mm-hmm.
Andrea, we heard a little bit about what is homelessness and housing insecurity. Who are our homelessness? Is it singles? Is it families? Is it seniors? What makes up our homeless population?
So it's everyone.
I'm going to ask the question again because I don't have the lavalier on. Andrea, thanks so much. Can you tell me a little bit who is our homeless population? Is it singles? Is it families? Is it seniors? What makes up our homeless population here in the city of Chicago?
Well, that's a really good question. So it actually is everyone that you just named in that group that we considered homelessness. So homelessness has several subpopulations. So we have our youth population, as Carol spoke about. There are folks, the youth that are aging out of foster care. And so they're considered our youth homeless population. Single men, single women, families, anyone with children 18 years or older, that's considered a family unit within homeless services. But then there also are senior citizens that are actively homeless or at imminent risk of being homeless. And those seniors, even living in their own homes, are at imminent risk of being homeless, and they also are considered in that same population.
Thank you so much. Carol, you
Yes.
run a wonderful facility called the Evangeline Booth Lodge.
I think so, yes.
Can you tell us a little bit about what you do there and how we are working with this population?
All righty. I'm the director at Evangeline Booth Lodge. Now, Evangeline Booth Lodge is just one of the many shelters that are for homeless families. At our facility, we can house up to 220 individuals, and that translates to 64 families. We are opened up 7 days a week, 24 hours a day, 365 days of the year. We have a staff that works around the clock to provide services and to provide for the family's needs. We provide 3 meals a day, and throughout Salvation Army, we are noted for our kitchen staff. We probably have one of the better kitchen staffs in the shelter system, I have to say. Their families receive breakfast, lunch, and dinner. To just give you an overview of what a breakfast may be, it may be bacon, sausage, scrambled eggs, pancakes, French toast, bagels, oatmeal, grits, and of course, milk and juice. For lunch, families receive a full meal, which oftentimes is chicken, a starch, a vegetable, and also the same for dinner. One of the things that I really like about Evangeline Booth Lodge is that you can eat as much as you want to. We have individuals who have 2 or 3 helpings of food, and we also provide a stack. Now, when families come into our program, they are, an intake is completed by either the intake staff or the shift monitors. Now, each family is assigned a case manager, and that particular case manager works with the families to obtain permanent housing and to receive financial stability. Now, what is financial stability? That means we work with people to obtain employment. If someone is unable to work for whatever reason, then we look at the traditional governmental entities to get SSI or public aid or what have you. Now, the families are required to save at least 80% of their earnings or their income. That way, when they do receive housing, they have a little nest egg to buy the necessary things that they need. We also refer people to community services for healthcare, mental health, and substance abuse. We do a lot of one-on-one crisis intervention because oftentimes our families have concerns or issues that go beyond case management. So we work with them extensively one-on-one. I like to say that we never stop working. I get calls in the middle of the night because someone has a crisis. Also, one of the latest things that we've done, we've started classes for our families. Our parents are required to go to a class each day for 4 days a week. And while they're in class, we do have a drop-in center where we provide daycare services to the children while the parent is in class. We work with the schools to ensure that our children get the necessary educational tools that they need to be successful in school. And we have a housekeeping staff who, of course, keeps the facility clean. We're hoping after we all rejoice when COVID is over to offer more services. We would like to see counselors in the program. So that's the vision. Hopefully it will materialize. And last year we had a renovation. So Evangeline Booth Lodge is going through a 2-part renovation. The first phase, all of the rooms that our families live in were redone. New flooring was put in, walls were repaired and painted, and we received new furniture throughout the facility. Now, in part two, we plan to be structured a little bit like the Shield of Hope. which means when people come in, before they go to the rooms, they'll have a space where they can shower and clean their clothing before they go up to the room. And we are also getting new washers and dryers because our families are able to, free of charge, wash their clothing. And so we want some new washing facilities for our families.
Sounds like a fantastic facility, and obviously working 24 hours a day to serve people in our communities.
Yes.
Andrea, can you talk to us a little bit about your beautiful facility in Shield of Hope and what you're currently doing with our homeless population in that facility?
Sure. So Shield of Hope is the nation's first emergency homeless assessment and response center. And so what that means is not only like Carol's program at Evangeline Booth Lodge, we provide shelter services in an emergency capacity. Families stay with us up to 14 days. We have 20 private and individual rooms where we can house up to 150 people, 20 families. And they receive case management services, access to an intake referral to all of the family shelters within the city of Chicago's network of family shelters, Evangeline Booth Lodge being one of those shelters that we refer families to. But they also get some extensive case management and a specialized care plan for every family. And it all centers around 5 key components to success. And it's housing being the first one, because every family coming to Shield of Hope is experiencing that housing insecurity. But it also has a lot to do with employment, connecting them with Salvation Army job training programs so that they can have an actual chance of receiving certification and trainings for better employment or to gain employment. It also centers around education, and not just education for the children, but education for the entire family. So that education could be a GED class for the parents, but it could be early Head Start and child care services from the Salvation Army's many child care centers and programs, and also connecting to local CPS schools for school-age children. But it also has a lot to do with health. We have a physician on site once a week from Rush University Medical Center that provides care to all of our families on site at Shield of Hope. And we also do a lot of training and educational classes around life skills, parenting, how to maintain a home. So once we get people housed or to their next step in life, they know how to actually succeed and function in their own home environment. So we like to think that we are the start of a better future and stability.
Great, thank you very much. Andrea, this is for you as well. I know we just, with the city of Chicago, just started a new contract with mobile outreach and transportation. Can you talk to us a little bit about how that impacts the communities that we serve and what that means for the Salvation Army?
Absolutely. So the Salvation Army is now the city of Chicago's leader in homeless services. Taking over this mobile outreach and transportation contract now gives us a full opportunity to do centralized intake for anyone needing shelter in the city of Chicago. So that's for families, singles, senior citizens, and youth. Anyone needing shelter has to go through the Salvation Army Mobile Outreach and Transportation Unit to get a referral to gain access to shelter systems. We also have the only centralized transportation services in this country for homeless population. So we will pick a homeless person or family up from anywhere in the city of Chicago and actually transport them to shelter. And it's the most fantastic thing I've ever seen. So this system is set for a person experiencing homelessness or a family to get picked up anywhere they are in the city of Chicago. So if you're on a bus stop, at McDonald's, at a relative's house, you can now be picked up and transported to a safe shelter environment where you get supportive services, and that is unheard of in homeless services. We also offer, with this new contract, senior well-being checks. So the mobile outreach staff actually goes into in homes to do assessments and intakes for senior citizens that might be in imminent risk of becoming homeless. And the goal to that is to put supportive services around them through the Salvation Army's in-home support services to keep senior citizens in their homes or to get them to safety. So it's a very complex system, but very robust services that are provided.
That's great. Thank you so much. And certainly as you're watching live at home, if you have any questions and are interested in asking the panelists anything about homelessness and housing insecurity, please feel free to type those into the chat box, and we will be reading those and asking those questions a little bit later in the show here today. You can't go a day without talking about COVID, right? That is always on everybody's mind. And I think one of the questions that I have is, how did COVID affect the delivery of our services as it relates to homelessness and housing insecurity? And if the both of you wouldn't mind sharing that from your perspective, that'd be great.
Well, I think it changed the practice of how we interacted with the participants in the program. Initially, a year ago, everyone was walking around in fear. I know at least at Evangeline Booth Lodge, the staff were fearful and the participants were fearful. You know, you would look at one another and you would always wonder, is that someone who has the potential to infect me? That was the general sense. I don't know how it was for you, but what we had to do, we had to think about how are we going to service people who are fearful of the person who is providing the service. So instead of one-on-one meetings, the case managers decided, well, maybe we could do Zoom meetings over the phone. Almost everyone in our program has a cell phone. And there were daily check-ins, there were meetings over the phone. In a normal environment, everyone ate lunch at the same time. We had to stop and divide the lunch hour into 4 separate times where families could eat and practice social distancing. I think the greatest challenge and fear that everyone had was when there was a potential of someone possibly having COVID in the program, and then Rush Hospital coming in and everyone getting tested. So I think for people who work in social services and people who receive social services, you're accustomed to that one-on-one, if you cry, let me hold your hand. And we couldn't do that. So we had to show empathy in a different way. The good thing for us was that we were going through a renovation, so our census was somewhat low because we were doing a fourth of the building each time in each phase, and then we would reopen. So again, I think for our participants, they felt comfortable with the fact there were not 220 people in the building. And it just changed the complexion of how we interacted with everyone, and just trying to alleviate the fears that the participants had as well as the staff.
I agree. Same for us at Shield of Hope. It really changed our relationship with our clients. So for the Salvation Army, we pride ourselves on relationship. The compassionate service is really driven by the relationship that we've always had with the people that we serve. And now we're talking about serving a very vulnerable population of people, but how do we do this with empathy and compassion, at a safe social distance. Boy, do you have to get creative in doing that? And we really had to be very creative with things like cohorting and making sure we knew which groups ate together, so we could always know who had who had exposure to what. But it was really putting real protection around the people that we serve in a safe environment so that they felt supported, but they still felt cared for. Our service delivery has always been intentional, but with COVID, we really had to be intentional in aspects that we never thought. Education for the children. Now that we're doing a lot of online school and the kids aren't in school, you're talking, how do you engage the students and children in tutoring services, supportive services that they would normally get at school on a school campus? How do we now bring that into the shelter, but do it at a safe social distance or virtually? So we were able to get creative with a lot of virtual tutoring. We had to get creative even with our medical services and how we were able to meet their needs on every level, but not take the relationship out of it and not make it feel so cold. The greatest fear we had going into this was, how would we still care for the people we've been entrusted to serve? And making sure the staff understood that they were at greater risk of infecting our clients and not the other way around. Our clients don't have a lot of access to anyone outside of our shelters. So we had a greater fear of going to grocery stores and bringing back a potential threat to our clients. So just the way we worked with each other, the way we worked with other shelters, the way we worked with our clients, very intentional, but very creative. And COVID, if nothing else, taught us to really value those relationships and supporting mental health, because now our families are truly isolated from day-to-day activities and people that they would see at school or at work. Those things were different for them as well. So being intentional in our service delivery, being creative, and always ever changing. The environment that we were in was ever changing. With every new guideline that came out, our work changed, but how we continue to protect and support those clients was really important.
I think the support was very important, because after being a year and a month into this, you can see how it has really affected the families, particularly the children, because children are social creatures. And unfortunately, because of COVID, we couldn't have those extracurricular activities within our settings. So how do you support kids and help them get through this? I mean, adults need support too. It's been a real trying time. Very trying time.
Great, thank you so much. And we talk about serving families, and usually when we think about families, we tend to always think about the adults and not necessarily always focus on our children. How does homelessness affect our children and affect the children that come to our facilities? And what do we do to help them through that time?
Well, children in homeless services go through a lot of trauma that many people don't understand or don't realize, because they are going along on this journey with the adults and they didn't have a choice in what happened next or how they got here. There are a lot of adverse childhood experiences that will now affect the children for a long time. And so what we have to always remember is, as we deal with the adult in the family setting, that the children are part of this trauma. And how do we support them? How do we make plans to end this cycle of poverty and homelessness with this generation, so that this is not something long-term that children will deal with? And I know for us, a lot of therapy sessions, a lot of counseling sessions for the children, because homelessness is a trauma that affects every member of the family and not just the adults. You see things like toxic stress syndrome in children after they've been in a homeless situation for so long. You see things like anxiety, depression, low self-esteem, aggression, and being able to have a holistic approach to service, not just for the adults that we serve, but also for those children. Very important, because it has a devastating effect that could be long-term if we do not try to do certain interventions with the children as we see the entire family.
And I think it's very important to work with the school personnel where the children attend, because what we have found, once other children either find out or realize that a child is homeless, the child is bullied. So we work extensively with the schools to support the children, to let them know they're not in it alone. And in addition to that, when a child first comes into your program, you can see the fear in their eyes. And, having to reassure the children that it's going to be okay. We're here to help you, mommy and daddy. And really not only forming a working relationship with the parents, but also forming and developing a working relationship with the children.
Great, thank you. Before I get into my next question, there's a great question from the viewers here today. And I'm sure you can probably spend 4 or 5 hours answering this question, but the great question is, what's the biggest need in our programs right now?
I think in my program, it's really developing more connections with employers who are willing to take a chance on a homeless person. I think that we have this perception of homeless people. And I tell you, for some of the families that live in our facility, you would never know that they're homeless. And also helping people connect to educational resources. I think oftentimes, which is important, people see the homeless and they think they need socks, hats, and gloves, but they need so much more. People are generous in terms of providing for the needs of children, but what I have found, people oftentimes forget about the adults. Like the guys, for example, sometimes they need a belt to keep their pants up. It's little things like that that they need, and they need words of encouragement.
I agree. So you have the practical needs, the toiletry items that
Right.
could always be used throughout facilities like Evangeline Booth Lodge and Shield of Hope. But you also have the supportive services that anyone can help us provide a card, a birthday card, or starting a birthday club for our kids so that they actually have a birthday gift and maybe a birthday cupcake.
Right.
Little things like that, donors or the general public can actually do by donating greeting cards that we can give out, or coming in and doing a craft, things like that, things that connect our families and our clients with the outside world, so that they know that they're not forgotten and they're not the castaway society that no one wants to engage with. It's that engagement outside of the shelter system. A field trip, taking them on a field trip, or donating, tickets to the zoo or museum, that cultural and experience that comes along with going to the Museum of Science and Industry, things that we all take for granted every day. They don't always have someone that can take them to do that, or that will do these things with them. And like Carol said, everybody wants to donate the very basic items, but sometimes your time
is very important.
Very important. Donating the time.
And mentoring. I think oftentimes, particularly with teens who are homeless, they need a mentor, someone who can, other than the parent, because the parent is focused on being homeless, but someone who doesn't have that focus and is willing to mentor a teen, a kid, even an adult.
Time is very different in homeless services. And Carol and I were just recently talking about that. Time is very different. So when you mentor or you donate your time, you help our families, and especially the youth in this population or in this system, think beyond the moment. And so when they can see things like how your life is right now, or if they can see things outside of what they would normally see, like a visit to a zoo, it makes them start to think a little different about their future. Hey, I want to come back here one
Exactly.
day, because the way time looks in homeless services, and for most people, they don't realize that it's a very immediate block of time that families and individuals in homelessness think about. It's right now. What do I do right now? Where will I sleep today? What will I eat next? So they think very immediate, but having mentors and having other folks come in to engage and show them other things makes them think about time different, and they start planning for their future, or at least thinking that there may be a future.
Exactly.
Great. Thank you so much for that wonderful information. There's certainly, I think, perceived stereotypes and myths about what homelessness is and how it happens. Can you play Mythbusters here and kind of share with the viewers, what are some of the myths about homelessness that need to be corrected?
I think that all homeless people have poor hygiene, which is not the case. That all homeless people are people who don't aspire for something more. And that's further from the truth.
Yeah. Homelessness has no face.
No.
People always ask, how do you know someone is homeless? Well, oftentimes you don't.
You don't.
Homelessness doesn't have a face. There's no poster child to homelessness. But the other thing that I think we hear a lot is that people have made poor choices, or because of drug or alcohol use and how they spend their money. This is why they're here. Homelessness is not a choice. No one woke up and said, I want to be homeless today. Homelessness is a result of trauma that happened sometimes years before the homeless status occurred. So it's backtracking and getting to that original trauma that led to self-medicating or alcohol or whatever it is, and then eventually homelessness. But homelessness was not a choice for many in the situation. No one wakes up and wants to be homeless, and homelessness does not have a face. Anybody can be homeless. We get a lot of people in our facilities that are employed, and if you saw them on the street and they go to work every day, you wouldn't know. I've had nurses that were homeless. I've had an attorney stay at Shield of Hope that was homeless. No one would know that these folks were experiencing homelessness because they don't know. We've had other shelter staff that were homeless, and they work in shelters, and their employers did not know that they were homeless. Homelessness has no face, and it is not a choice.
It's not.
Very interesting. Help me also understand pre-pandemic, when we weren't all locked down. What's the season that we would see? I know there's a myth on that of all homelessness come to shelters in the winter, or all come in the summer. Talk to us a little bit about what the reality is in that.
The reality really for homelessness really depends on the subpopulation that you're talking about. So when you're talking about family homelessness, and Carol can attest to that, with family homelessness, it is high volume in shelters in the summertime, spring and summer, not winter time. So many people will think that in the winter, you're going to have an increased number of folks experiencing homelessness, and they'll be in shelter. For single men and women, that is the case. In the winter, single men and women experiencing homelessness cannot panhandle. They don't have the access on the street. It's too cold to rough it. So you'll see those shelters that serve single men and women have an increase during the winter time. But when it comes to families, family members are more likely to let you stay in their home in the winter time because they don't want to see you out on the street or know that you're in the shelter during those key holidays like Thanksgiving and Christmas. So they'll take you in. And then when you get to January, it's empty in shelters. Shelters, everybody's gone because we get to tax season. And so there's an increased income. And so you can actually go and stay at a relative's house during tax time.
Or a hotel.
A lot of folks decide to hotel. Or you can stay with a relative because you have this increased income. You can share your income with a family member. They'll let you guys stay in your home. When you get to summer and school is out, generally before the pandemic, what would happen was relatives would say, you guys can't be in my house all day long. You gotta go. So you see shelters for families increase in the summer, and single men and women, they can brave it on the street because the weather's nice. Those shelters get empty because they're out there and they can live in the elements. So it's really climate, and the Midwest is very interesting because of the climate change. That's how we know when spikes and drops will happen within shelters.
It's true.
Thank you so much. I think the last question is, what's next? We're already doing an awful lot of things in the city of Chicago, but there can always be more. And what's next for the Salvation Army as it relates to homelessness and housing insecurity?
The Salvation Army does a lot of things very well when we talk about service delivery and being a service provider in the Chicagoland area. So when we're talking about the next, increased collaboration, increased community engagement, increased supportive services, but very intentional in who we're collaborating with, what our focus is on, and how to increase the quality of service delivery, not only throughout our own shelter programs, but throughout the shelter system. With the new mobile outreach and transportation contract that was awarded to the Salvation Army, one of those things that we've been focusing on is how do we increase the level of service delivery throughout the entire shelter system in the city of Chicago. And we're talking roughly 67 other shelters. How do we come up with a real service delivery plan with person-centered care and a person-centered approach to make a true impact in homeless services, so that when someone is experiencing homelessness, their bout with homelessness is going to be brief and non-reoccurring. And so we're really talking about how do we put the right structures and systems in place, and who are the key people to do this with, not only the Salvation Army, but the city of Chicago. And so it's very intentional service delivery, but how do we collaborate across the board, coordinate services to reduce the amount of engagement that someone experiencing homelessness has to go through? So just continuing to be visionary leaders in this, but true servant leaders as we work through what's next. So I know Carol is working on some amazing things just in her facility and for her program that I'm sure she may want to share.
Yeah. I think for Evangeline Booth Lodge, we want to be the premier shelter for families. We want to be a leader, not only in the city of Chicago, but nationwide, in terms of working with families to end once and for all their cycle of homelessness.
Great, fantastic. I have another wonderful question. Once COVID relief runs out, in the sense of the moratorium on evictions and relief there, how do you feel that's going to impact the shelter system as a whole?
Well, we're going to see people experiencing homelessness that have never been in these particular situations. So that's going to increase the number of people needing to access services and access shelter, but it's actually going to be a different population of people. And so it's going to make us have to expand our services in a way that we haven't had to before, providing more intensive counseling, more intensive supportive services, focusing on a holistic approach, mental, spiritual, physical well-being of people, because we're going to see an increase of people experiencing homelessness once these things like the stimulus payments and the moratoriums are lifted. So we just have to continue to really be innovative in our approach, but purposeful in how we attack this, and taking the time to develop the key relationships with other employment agencies and corporations that can, like Carol said, can actually support us in getting people employed so that they can reestablish living situations very quickly, and that their bout with homelessness really is brief.
Yeah, I would agree with that. I think we're going to see in this country and in this city a different side of homelessness, as Andrea said. You know, many people have lost their jobs during COVID, and now after job loss, once the moratorium ends, now it's going to be, I'm losing my home. So I think that's going to affect families very deeply. You know, we often talk about stages of grief. And I think with unemployment and losing your home, it's like someone has died in your family and you have the various stages of grief. And we're going to have to change the way that we provide service and the way to get people to move through the system quicker.
Great. And if you have a few more minutes, we have a couple of other great questions
Okay.
from our viewers. One of them is with both of your facilities and programs. How are we currently helping people get employed?
We have access to employment services from the Salvation Army Freedom Center campus, and there's an entire job training program that happens in that campus directly across the street from the Shield of Hope. So all of our families are connected to our transitional jobs program and training services. And what happens in that program, which I love so much, is that not only do you obtain a skill that's a marketable skill that helps with gainful employment, but you are also paid during that training. And so that allows families to earn an income. We've employed throughout the Salvation Army, just in Shield of Hope, so many of our clients and former residents are now Salvation Army employees. So that's the one thing I can say. The Salvation Army has done a wonderful job actually, not only training current clients and using our resources within to provide employment opportunities, but we've actually, even employees that have not gone through job training with us, we've hired several of our clients as employees. So that's a huge accomplishment, because many agencies are not able to do that, but the Salvation Army does that very well in the Chicago area.
And I know we're here on the north side, so we have worked with various organizations on the north side. And actually our neighbor, which is the nursing home next door to us, has worked with us to hire many of our participants in our program. And pre-pandemic, we worked with other organizations such as CARA, who provides job training and job placement as well.
Great, fantastic. A couple of other questions from the viewers. What can the community do to help?
Volunteer
Donate your
and
time.
donate your time.
Donate key resources, toiletry items, clothing for men. That's always a big one
Yes.
within family shelters. Many people don't realize there are a lot of men that live with their children as single fathers in shelters. So donating clothing for men, toiletry items, and time.
Fantastic. And, I want to thank the both of you for your time today. It was, I think, great information. I certainly learn a lot every time I get an opportunity to chat with you, and the work that you do is just amazing. And we really appreciate all that you do for the communities that we serve. And certainly thank you to the viewers for attending today. And I think hopefully you've learned a lot as well. And as the final question about how the community can help, certainly please visit our website at salarmychicago.org. We've got some great resources on there about homelessness, housing insecurity, and a lot of our other programs that we offer here through the Salvation Army. There's also opportunities to check out our volunteer services page and see how you can help programs and services like Andrea's and Carol's. And certainly also, as we talk about investing your time, talent, we're also asking for your treasure as well. So if you have the ability and are so inclined to donate, we have a fundraising page, Donate Now, on our website at salarmychicago.org. Certainly encourage you to do that, and very much appreciate your support. I hope this was enlightening. I hope you'll join us again. We have town halls on a quarterly basis that we will be certainly inviting you to, and I hope you will share this with your friends, family, colleagues. The more you know, the better we can serve our communities and the people that need us most. So thank you. Have a great rest of your day.
you.